I'm Jeff Schwartz, Chief Medical Officer for ECI. With summer ending and our children going back to school, please be aware of the continued threat of the H1N1 virus. According to the CDC, 159 million people are at risk of being infected in this country alone. Those most at risk are pregnant women, those in close contact with infants, healthcare and emergency services workers, children, young adults, and those under age 65 facing disease or chronic illness. Through July, over 6,000 hospitalizations and 400 deaths have been attributed to H1N1. In fact, over 50,000 cases have been diagnosed in this country alone. With school starting, the CDC expects a resurgence of H1N1. We need to be ready for this and understand what we can do to help care for and control this serious disease. H1N1 symptoms are like those of the seasonal flu. They include fever, cough, sore throat, runny or stuffy nose, body aches, headaches, chills, and fatigue. Many patients with the virus also present with diarrhea and vomiting. H1N1 is spread by person-to-person contact through coughing and sneezing. Infection can also be spread by touching an object that has traces of the virus and then touching your nose or mouth. Patients are contagious with H1N1 one day before they develop symptoms and up to 7 days after they get sick. Children are often contagious even longer. H1N1 can be detected in the emergency department by using rapid influenza diagnostic tests, with results typically available in 30 minutes or less. While positive test results indicate that infection is likely, negative results do not rule out an H1N1 infection. If there is strong clinical suspicion, patients should be started on antiviral therapy. The CDC approves both oseltamivir and zanamivir for treatment of the virus. Treatment is most effective when started within 48 hours of illness onset, so antiviral therapy should begin as soon as possible. People can treat and prevent the H1N1 virus in the same way that they ward off the seasonal flu. This means covering their mouths and noses with tissues when coughing and sneezing, washing their hands with soap and water or with alcohol-based cleansers, and taking extra precautions around patients with symptoms of the disease. If diagnosed with H1N1, patients should remain home from work or school for 7 days after symptoms begin or until symptom-free for 24 hours, whichever is longer. In closing, I'd like to commend each of you who cared for H1N1 patients last spring. I would also like to thank you for your dedication and for the wonderful patient care that you provide within our partnerships across the country. You all make a difference by being on the front lines and by delivering the highest quality health care found anywhere.